twisted your ankle, that's often an acute ATFL injury, which is one of the commonest ligament tear in our body, around 75 to 80% of all the sprains. So what is ligaments? Ligaments are the structure which connects two bones in our body. So whenever these ligaments are injured, they get much longer time to heal than you think, because unlike muscles and other organs, they have a direct blood supply, the arteries and veins. But the ligaments, they get nutrition from the surrounding fluid, so they take much longer time to heal whenever they are injured. So what is the best practice to get back to the normal faster without much any issues? Put it in a plaster cast for a long time can make you harm more than it helps. Hey guys, welcome back to my channel. Today let's focus on how to get back to the normal after an acute ATFL injury of the ankle joint, and how a plaster cast can make you more harm than it helps, and what are the safe movements which we can do during the resting period, and how to prevent ATFL injury. So let's get back your ankle faster. The ankle joint on the outer side looks like this. The main bone on the outer side, we have the fibula. This is the fibula, and we have the tibia, which is basically on the this side, other side, okay. And we have this bone. This is called as talus. So talus and the tibia, they together make ankle joint. And here we have on the down, we have another bone. This is a heel bone, which is also called as calcaneus. So these are the bones we see on the outer side of the ankle joint. Ligaments connecting these bones. So the ligament which connects the fibula and the front of the talus, this ligament, this is called as ATFL. This is the ligament we are talking about. So this is the ligament we are talking about, which connects the fibula and the talus in the front. There is another ligament here which connects the fibula to the calcaneum. So this is called as calcaneofibular ligament. And we have one more ligament on the back which connects the fibula and the talus from the back, and this is called as PTFL, that is posterior talofibular ligament. So that is the structure of the ankle on the outer side. Whenever you place your front foot on the ground and then your ankle goes into inwards rolling like that, so this is called as inversion injury. This is the ligament is vulnerable for the tear. So when you are weight bearing on this side of the ankle of the foot, this is, so this ligament get injured. So this is the CFL get injured. And how this ligament get injured is whenever the foot goes into inward rolling in this position. It's very rare position. So most commonly this is the position the ankle get injured. So the injury has three gradings. The grade 1 is just a sprain where he can weight bear, he can walk with slight pain and swelling. Grade 2 is a partial injury where he can walk with a limping. And grade 3 is the severe form of injury where he cannot walk or weight bear. Usually grade 3 injury associated with the bluish black discoloration of the skin because of the internal bleeding. Apply ice as early as possible to prevent swelling. This is the clinical test we do to diagnose the ATFL injury. We hold the foot in the neutral position and slightly pull it forward and see is there any opening in the anterior joint line. More than 5 to 10 millimeter opening is indicative of a grade 3 injury, and this is a modification of the test. We just push the leg backwards, and again we see the anterior joint line opening up. So this patient is able to walk with a slight limping and slight pain, and so it's basically a grade 2 injury, and he has a swelling in the ATFL area, and he has a tenderness over the the front of the fibula bone, and mild ecchymosis as well. So this is a grade 2 injury, and the X-ray is taken to see is there any fracture, and he is a regular the football player. You can see there is a repeated injury and anterior impingement of the ankle joint with a spur formation, and so he is having a ATFL injury for the first time. Unfortunately, this gentleman had acute ATFL injury just the day before of his travel plan. So he was not sure about the rest protocol, and he presented to me after 1 day of the injury, and the pain and swelling was not that much. He had a moderate swelling, so I gave him this cast immobilization, and ideally the cast immobilization is not advised for such injuries. Only a slab is given just to reduce the pain and swelling, maximum of 3 days to 1 week. Soon this has to be changed to a functional cast bracing or a taping. So what happens if you give a plaster immobilization for more than 1 week is that while the ligaments are healing, the newly formed collagen fibers orient themselves into a favorable parallel pattern only when the joint is loaded and the movement is allowed. So whenever we restrict the movement, so the newly formed collagen they orient themselves into a crisscross pattern, which is basically a scar tissue, and so the scar tissue is having a less tensile strength as compared to the natural ligaments. So these patients, whenever they return to the sports, there is a high chance of recurrence of the injury. So the immobilization, it leads to significant adhesions of the tissue surrounding the joint, which leads to the stiffness of the ankle joint. POP can increase the chance of stiffness. It increases the chance of re-injury, recurrence of the injury, as high as 20 to 30%, and it prolongs the return to the sports by 2 to 3 months, and it needs a prolonged physiotherapy and to strengthen the muscles and to regain the movements. So these are the problem with the plaster. So what is the best treatment? So the best the practice for such injury is functional cast bracing. For type 1 ATFL injury, usually the swelling subsides in a couple of days. If the skin condition is good, you can use these kinesio tapings. Various techniques are described. Better to avoid circumferential taping, because which can hamper the lymphatic flow. And these tapes should be changed every 3 to 5 days to avoid skin irritation. These tapes are good, which can prevent inversion movement. At the same time, they allow dorsiflexion and plantar flexion, that is upward and downward movements of the ankle. For grade 2 injuries, we need a little more stability in inversion and eversion direction. So we have this lace-up ankle brace which are available, and they can be very useful in preventing the this inversion and eversion movement of the ankle joint, and they give more stability. At the same time, there is a less skin irritation, and they are very comfortable to use. And even the recent literature shows the lace up brace are superior to the tape techniques. For grade 3 injury, we need more support. So these are the braces recommended. So these are the specialized air cast boot which are available. So you can see they can be very comfortably worn, and they are very functional as well. And so there is a air pump inside. We have a balloons there, and whenever we inflate these balloons, they helps in even reducing the edema, and they can be worn comfortably, and we can even walk with the support, and they prevent the inversion and eversion movement whenever especially whenever we use them along with a lace-up brace. So during first 3 weeks, limb should be protected with a protected weight bearing with the crutches. After 3 weeks, the gradual stretching exercises are started. This is a prayer position stretching exercises, peroneal stretching, Gradual stretching of the calf muscles. In grade 1 injury, return to sports is possible after 3 weeks. In grade 2 injury, return to sports is possible after 6 weeks. And in grade 3 injury, return to sports is possible after 6 weeks to 3 months duration. And if it is a chronic recurrent type of tear, you may have to wait up to 3 to 6 months. And in athletes, it's better to tape and use the brace up to 6 months after this injury to prevent the recurrence of the injury. So these are the strengthening exercises to strengthen the peroneal and inverters and the calf muscles before you start playing. This is the oval board to get back the balance, strength, stability and proprioception of the ankle.
When the instability persists even after 6 weeks and very high demand athletes and grade 3 injury, surgery is indicated.
Please subscribe to my channel. I hope you liked the video and it was informative. Please like, share and comment. See ya.